Any questions? Yes, I see Jill.
POTS diagnosis is something that some GPs are very conversant with and able to make a diagnosis quite easily. So, it's like all doctors, we have our areas of interest and expertise. So you may be quite lucky that your GP has that sort of knowledge. But generally, a POTS diagnosis can be accurately made by a cardiologist or possibly an endocrinologist who's a specialist in glandular illnesses. So it is important to get a proper diagnosis, because the treatment then can be very specific to you and give you a much better chance of improvement in your overall health.
Who's that? That's Karen. Yes, I'll just unmute you there.
Okay. Yeah, well, vertigo is really the description of a symptom, and it, if you translate it into English, it means dizziness. So dizziness can occur, of course, for many, many reasons, and POTS is one of the reasons. And dizziness is treated in many different ways according to the reason for it. So, for example, you can be very dizzy with just too much wax in your ears, which is very simply and easily treated. On the other hand, you may have some sort of abnormality or disease of your inner ear mechanism, which upsets your balance, or you may have POTS. So I think getting a correct diagnosis is the first thing, and then hopefully having appropriate treatment.
Thank you.
A question come through the chats as well, Dr. Vallings, asking that because glandular fever comes up quite often for various illnesses, is anyone working on a vaccine or a way to prevent ME chronic fatigue in the first place?
You mean a vaccine, I suppose, for glandular fever? Well,
yeah.
Nobody has come up with a vaccine for glandular fever. And I think probably the reason being that there are many other, let's say, very severe illnesses which are life-threatening, where the vaccines research has gone life-threatening, or things like polio and smallpox and measles and so on. So there hasn't been any obvious research into a reliable vaccine for glandular fever. And it's a very common illness. It's thought that probably something like 70% or more of us will have had glandular fever without ever knowing it. So when you do a blood test for glandular fever to see if a person's had it, something like about 75–80% of the population will have had glandular fever at some time. So in the vast majority of cases, it's very, very mild and rarely would be life-threatening. And I think that's why vaccine research hasn't focused on that particular illness.
Okay, all right, Steve.
Well, I think, COVID obviously is a viral infection, and so-called long COVID is obviously a post-viral syndrome of some sort. Post-viral syndrome is the phase many of us will go through following a viral illness of a specific sort. So you can get a post-viral syndrome following a common cold or flu. ME, of course, is the classic post-viral syndrome. Frequently it occurs too after glandular fever. And of course, we're learning that after COVID, quite a high percentage, could be as high as 10% of people, are suffering from a post-viral syndrome that they're labeling long COVID. Now, a lot of those people will be recovering, and in fact, in many of the studies have recovered, which is again very typical, say, after glandular fever, when something like 95% of people will have recovered at about 3 months. And this may well happen with many of the people with long COVID. They're going to recover by 3 to 6 months. So that would have been a classic post-viral syndrome. And post-viral syndrome typically does mimic the symptoms of the illness that triggered it. So if you have glandular fever, for example, you get sort of sore throats and glands recurring. And it seems with COVID, the post-COVID syndrome, long COVID, is characterized by ongoing symptoms of their original illness. But, you know, it's too early to say how many of those people are going to recover completely, and we hope that, of course, most of them will. But inevitably, as following almost any viral illness, there will be a bunch of them who will remain ill with a ongoing post-viral syndrome, such as what ME is really. So I think they are very, very similar. They're different because the initial illness is perhaps rather more specific and definite. So there will be a lot of problems like, say, respiratory problems and loss of smell and what have you. But theoretically, the underlying what's going on in the immune system is probably going to turn out to be very, very similar to ME. I don't think there's going to exactly be a cure just like that. But I think the good news, of course, is that huge volumes of money are being poured into research for long COVID, to try and understand it and get people back to work and that kind of thing. And of course, all that research is going to brush off onto ME, which is just another sort of area of the same illness, really.
Right.
That's my take on it anyway. I'm not, well, I am a betting person in that I would enjoy, you know, the odd flutter, of course, like we all might, but I wouldn't make a bet on it at all, except to say I think it's the money going in makes it highly likely our understanding will increase of all these illnesses.
Right.
Great.
Yeah.
Thank you. Good question. Another chat. Is there any specific support for ME sufferers from DHBs or ACC?
Okay, well, a little depends on where you live and how interested the doctors in your particular DHB might be. So in some areas, there's very good support from, you know, maybe clinics that do sort of have chronic pain and POTS involved in their clinics. And of course, these people will be seeing a lot of ME patients. And so certain DHBs will have good support networks in place, physios who know what they're doing and so on. But of course, many other DHBs, partly lack of personnel who might be interested or lack of money that they can pour into it, have very little available for people with this illness. So little depends on where you live. ACC may not necessarily be appropriate at all unless the illness is proven to be triggered by a specific accident. And that wouldn't be that common, actually. But if any illness is proven to be triggered by an accident, then that person becomes eligible for some ACC cover, which may involve treatment or support in their community, or even monetary income if they're unable to work. So it varies very much, and this isn't just in New Zealand, this would be a worldwide issue.
Okay, lovely. I'll just have to scroll my screen across because we've got so many attending today to see if anyone else has got their hands up for yes, Connor.
Well, it's hard to say. I mean, I know of many people who've given in completely and given up work and so on. And, you know, that doesn't guarantee recovery, I would say, that's for sure. There's an awful lot of unknowns in who's going to recover and who doesn't. And just as there are many, many probable subgroups of this illness, some people of which will recover more likely than others. So taking time out completely doesn't guarantee recovery. recovery, but it certainly improves your chances of doing better, let's say. But there will be some people who continue to work very hard and recover. So I'm afraid it is an unknown, and the financial issues are very, very hard, I know, for some people. And, you know, if you've got major commitments like mortgages and families and what have you, taking time out is just not always on the radar. But certainly the opportunity to have time out, or even sometimes the opportunity to just have a really good holiday, can make a difference.
Yeah.
Right, I've got some hands up here. Kerry Jackson, would you like to pose your question?
Hi, I've been wondering if it's okay to just get yourself mobility aids. Like I was thinking about getting a wheelchair just for long trips so I can take my kids to the zoo and things like that. Do I need to consult a medical professional, or can I just judge that for myself?
Well, I think you can judge it for yourself up to a point, but of course, if you want financial help with aids, then certainly sometimes your health practitioner can help you with that. I think one of the disadvantages of taking on board aids is, of course, that one physically can do less, but at the same time that may be hugely beneficial. So every person, it's an individual in all this, and I think, you know, I encourage people to use aids if they feel themselves it's going to improve the quality of their life. I think that's what really is the bottom line. So if by having a wheelchair you can take your kids to the zoo, yes, I'd say go for it. But, you know, at the same time, don't be dependent on the wheelchair for everything, because you could get less physically able because your muscles get very weak. So everybody's got to be weighed up in light of their particular needs, and that applies to every illness.
Yeah, so true. I've noticed that clients that I've worked with, Kerry, that have got some sort of mobility device have found that they can participate a little bit more in society and with family events and things, which makes it hugely rewarding for them. So yeah, personal choice at the end of the day, but you definitely hear what Dr. Vallings has said too about it could create under mobility as well. So we also have another hand up there from sorry, I haven't got a name there. It just says iPhone and then the phone number. So would you like to pose your question? Another question that's come through the chat: what do you think of the supplement, and I always struggle to get my mouth around this one, in acetylcysteine, I think that's how you say it.
Acetylcarnitine?
Oh, there we go. I didn't even get close, did I? Yes, someone's asking, what do you think
Well,
of
it's
that?
one of those supplements that's been talked about a lot. And I mean, I'm talking 10 years ago now, listened to a Japanese presentation at a conference where the professor of medicine from, I think, Tokyo had himself taken vast amounts of carnitine to see whether it made any difference to his blood levels of carnitine. And he found that even by taking a very large bottle of this carnitine, which is not poisonous, daily, his blood levels didn't go up at all. So it was almost like it was just going straight through him. So that kind of had a message somewhere along the line. I'm not sure. I think if you had a proven carnitine deficit, which I think is very hard to measure, but possibly can be measured if you were under some sort of biochemical team. And if you had a proven deficiency, it may be appropriate to replenish it. And it's not sort of poisonous, but there's not really any real evidence to support its use as a routine supplement at all, really.
Okay, all right. Samantha Stockbridge, you got your hand up there. What would you like to ask?
I was asking about the supplement NAC.
Oh, that was you, right? Yes.
Yeah.
Did Dr. Vallings answer your question there?
No, she talked about a different supplement.
Oh, I'm sorry. I thought you were talking about N-acetyl.
N-acetylcysteine. They call it NAC.
Okay, well, I won't be able to answer that very accurately because I don't
Right.
really know much about it. But I think if we were looking at this as a possible, major benefit in chronic fatigue syndrome, we would all know about it. And sadly, I don't know about that one, but I
Right.
will look it up for you and look up and see whether there's any current research, and I'll get back to Tracy on that, okay?
Oh, thank you so much, Dr. Vallings.
That's all right.
Great, lovely. Someone here is asking on chats, is ME fibro an autoimmune disease? And if so, what medical category or name does it come under?
Sorry, could you start the question again? I didn't get the first few words.
Okay, is ME or fibro an autoimmune disease?
Is ME and what?
Fibromyalgia.
Oh, fibromyalgia, sorry. Are they autoimmune? Well, the thinking is, in light of the current research, which is nothing new in this area really, is that certainly chronic fatigue syndrome may well be an autoimmune disease, but it's not proven to be such. And similarly with fibromyalgia. But certainly there has been a lot of talk and research over the years looking at that possibility. And it has got a lot of common ground with some of the autoimmune diseases from the point of view of symptoms and things. But certainly there's no real proof that it's an autoimmune disease. It's just a strong possibility.
Okay, right. Anyone else got their hands up there? All right, so another person has asked, how can we get a mandate for every GP to become educated about ME chronic fatigue? I tried to contact many practices in Hamilton to find a suitable GP, but they either didn't respond or told me they didn't have a medical professional that could help me. So where do you think we're at on getting all the GPs educated?
Well, I think, one of the problems is, and this illness is not specific to this issue, that there is so much to learn, and there are so many diseases that we can't know much about everything really. And I think in order to become really conversant with an illness like ME, a doctor has to have a very real interest in it, either because they're fascinated by that particular area of science, or maybe they've had the illness themselves, or had a family member with it, or had a lot of patients with it. But the majority of GPs throughout a general practice lifetime may only have one or two patients with this illness. I know that's hard to understand when there's an awful lot of you, but that's the reality. And many doctors I've spoken to over the years have never had a patient with it, or never had one that they suspect might have it. So it's not that common an illness in general practice. And in order to learn enough about it to feel confident about treating it properly, there's a huge learning issue really, and there is so much else out there we have to learn about other diseases that we can't know everything about every illness. And I use my own example. If you face me with a patient with something very common like asthma, I'm completely lost and I don't feel confident about treating it at all. And so you're kind of looking at sort of triggering a doctor's interest in some way by that doctor having a patient that needs to be investigated and dealt with who happens to have this illness. So it is quite hard. And again, there's a lot of medical education going on out there, but there are so many thousands of diseases that this one just occasionally gets picked as this is the one that will have a session on this month in Timaru or something. So, you're kind of battling against all the other many diseases. And the common diseases like hypertension and diabetes get far more input because a lot of people have them, and many GPs will have a lot of patients with those illnesses on their books. And that's where they learn. We learn from our patients.
Yes, so we do have GP packs available, everybody. So if you are struggling to have your GP understand we are quite happy to post you out a GP pack that you can take along if you think that they're open to you educating them. So I do hear my clients often saying that they educate their GPs, which is really great to see. So let's hope you have a GP that is open to being educated. Okay, we've just got another question here. Someone's asking about some advice around joint pain. She's on 700 milligrams, but doesn't seem to be doing anything for her joint pain. Is there anything else you can suggest, Dr. Vallings?
So 700 milligrams of what?
Oh, sorry, ibuprofen.
Sorry?
Brufen. 700 milligrams of
Okay,
Brufen.
Well, pain is, again, a speciality in its own right, really. I mean, probably a huge number of diseases are associated with pain, and there are many, many different types of pain, as we all know, many, many different types of pain. And even in ME, there are many different types of pain in ME. So it's not really possible to give a blanket advice as to what medication may be suitable for what patient. The pain needs to be investigated thoroughly to make sure that the doctor understands and knows what the pain is due to. And it could be many, many different causes. And of course, as a result of that, many, many different forms of treatment. So I think if a pain medication is not working, it means the pain needs to be looked into further, or a different approach needs to be taken. And sometimes that's got to be a focus on sleep management, because sleep is one of nature's natural ways of healing pain.
Good call. Yeah. Okay. Someone else has asked, what's the possible link or cause of heart palpitations that come and go with fibromyalgia and ME?
Well, it may be POTS. I mean, palpitations, rapid heartbeat, and if a person is standing up suddenly or standing for any length of time, their heart will start to race to try and push more blood back into the brain. So again, that needs to be investigated to find out. The palpitations may, of course, be due to anxiety, and that would be the commonest cause of palpitations. You know, we all know that feeling of apprehension or shock, whereby your heart suddenly races like crazy and you feel all hot and sweaty and anxious, not necessarily actually feeling mentally anxious, but you have symptoms of anxiety due to a lot of adrenaline being poured out into your system. So palpitations can be due to all sorts of reasons, but they can be treated. But the treatment, again, needs to be very specific to the cause.
Okay. I see Wendy putting her hand up there. Wendy, would you like to pose your question?
Okay.
There we go.
Firstly, I wanted to give some feedback for the person who had the very first question about POTS. I got diagnosed with POTS yesterday by my GP, and I simply just took a list of the symptoms I had in, and she diagnosed me, and she also referred me to an orthotic centre in Hamilton to potentially get free assistance for what do you call them, compression socks. But Tracy sent me a really helpful handout on POTS, which made me feel more comfortable that my doctor had correctly diagnosed me. And that handout from Tracy was incredibly helpful. But the question I've got for Dr. Vallings is, with the my husband and I both have chronic fatigue. With the CoQ10, what type of dosage would you recommend? And would you just recommend it as a standard supplement for everybody with chronic fatigue to take?
Well, again, I think, you know, everyone with chronic fatigue syndrome is very different. So it's not going to necessarily do much for some people. And for some people, there may be benefit. And certainly Professor Tate's research is ongoing, looking at this particular compound. And we may then get some more confidence that we're onto something that's worthwhile trying. The downside of CoQ10 for most people is cost, and it is expensive. And usually one shouldn't start with too high a dose, because there are some people who it just doesn't agree with at all. So I usually get people to start with about 50 milligram in the morning, and then just increase it to perhaps, I think Nancy Klimas in Florida uses about 200 milligram each morning. But the main thing is to start with a small dose to just check that it's not going to disagree with you, because some people don't feel good on this at all.
How long do you think it would take to notice a difference?
They say probably you need to do it for about a month and then stop it for a day or two and see if you notice any decline. And the reason for doing a stop thing like that is it can happen with a lot of things. You might be going through a slightly better phase anyway, and you might be wasting your money because you might not actually need it. On the other hand, you might find if you stop it, yes, you definitely don't feel quite as good.
Okay, that's really helpful. Thank you.
Okay. Talking about supplements, someone has asked, is it safe to take B12 and magnesium supplements if you are not deficient? Also, is there a connection with calcium getting in or out of cells and scroll down here, and osteopenia or osteoporosis in someone with long-term chronic fatigue syndrome is 40 years?
Okay, there's several questions there, aren't there?
Yeah.
First of all, calcium levels, the calcium moving in and out of cells, which we talked about earlier on today, is nothing to do with your calcium level. It's just the way your body works all the time. Calcium in your system is moving constantly in and out of your cells. And it's important not to take too much calcium because it can have side effects. So calcium should be viewed with not exactly caution, but not overdoing it, and talking to your doctor about it, and making sure perhaps better that you have plenty of calcium in your diet, say milk and dairy products, fish, bony fish and so on. So calcium is a little bit different than the other question. Part of the question was B12 and magnesium, and both B12 and magnesium can measure low when you have a blood test for various reasons. It may be a dietary lack. For example, vegans often get very low in B12. So, if those things are shown to be definitely low on a blood test, then definitely you may well need supplements, which could then be monitored carefully. On the other hand, we do sometimes up the magnesium levels to improve sleep management, and also muscle cramps and muscle pain can be improved by having extra magnesium. And B12, I alluded to some of the earlier research. Certainly the B12 has been shown in several studies now to have some benefit if the levels are above the normal range. A lot of doctors get a little bit anxious when they see the levels going up very high because they don't necessarily have the background knowledge as to whether that's a safe thing to do. But there doesn't seem to be any nasty side effects coming out of the woodwork by having extra B12. Again, I wouldn't guarantee it because I think one cannot, but certainly it does seem to be a relatively safe thing to do.
Great, thank you. Mandy, your hand is up there.
Hi. Thank you, Tracy, and hi, Dr. Vallings. I really appreciate you taking the time this morning. This has been extremely educational. So I've been working a lot with genes at the moment and different supplements from a company in America, and I'm not trying to promote them or anything. It's just that I've dabbled with so many different supplements in the past that have done nothing, and I really feel that these are doing something for me. Well, of course, it's not a cure, but I take 5,000 milligrams of B12 a day in an active form, and it definitely helps. And I take a PQQ daily, and I just wondered if Dr. Vallings knows much about the PQQ, because I have felt a huge benefit in my muscle pain and decrease of muscle pain with my fibro, as well as the gosh, I can't get it all out now. I know that my mental health has not mental health, cognitive things have improved as well. I take a variety of the different ones because I'm trying to figure it all out to rebuild the cells. And I'm very grateful that my GP works closely with me and monitors me on all of these. And it kind of refers a little bit to some of Dr. Tate's research as well. So while we're all different, I appreciated just hearing just then about how you're saying the B12 is something that can't really harm us if we take too much of it.
Well, I suppose you could say it could harm you if you take huge amounts. It's very hard to say, again, because everyone is different, but certainly there is enough research to make one feel fairly confident that B12 can be helpful for some people, but not everybody with the illness. And also it's relatively harmless in that I've had people over the years who've taken quite a lot and haven't had any nasty ill effects come out of the woodwork. Sometimes if you talk to blood specialists, they get a little uneasy about it, because I think there are a few blood diseases that can be aggravated by too much B12, or it can perhaps lead to some of the blood diseases. So I think you have to be a bit cautious. And I think for anyone on any high dose of any supplement over a length of time should have regular blood picture, blood count done, just to make sure they're not damaging their system in any obvious way.
Yes, so that's the thing. Like, I have my bloods done regular, and it's quite scary to think that my B12 level is only mediocre. So that's quite scary.
If you're taking the B12 by mouth, you're possibly not absorbing it very thoroughly. B12 has been shown not to be easily absorbed by mouth if your blood level is within the normal range. And the only way to get increased B12 into your system is by injection.
Yes, I did them I did those years back, and I got no result. I did them weekly for I think 6 weeks. However,
you may be a person that just turns it over very quickly and will never achieve a particularly high level.
Okay, thank you. And so, do you know much about the PQQ?
No, I've never heard of it.
Okay.
Colleen O'Connor, you've got your hand up there too.
Yes, I do. Hi, Tracy.
Hi.
Dr. Vallings, I've got a very weird question here, and most men won't most probably appreciate it. It's to do with the period and everything like that. I've been diagnosed with fibromyalgia and chronic fatigue, and I was just wondering, why is there so much pain when the period is very irregular? Like, I had to go off the contraceptive pill due to too much pain and just the constant bleeding. Is there any difference, or what can we do to resolve all these pain issues?
Right. Well, I think if there's a lot of pain and trouble with periods, then that needs to be reviewed by a gynecologist who has an interest in hormonal disorders, because there could be a lot of help there, but also, you want to be sure that the diagnosis of your menstrual pain and menstrual disorders is correct. But more importantly, it should be able to be treated properly. But people with fibromyalgia do feel pain more intensely than people who don't have fibromyalgia. So one of the sort of definitions associated with fibromyalgia is an increased sensitivity to pain, and they found that there are issues in your brain cells in the way they monitor and manage pain. So it's a kind of brain abnormality, if you like, the fibromyalgia part. So your period problems may relate to your fibromyalgia, or they may be quite separate.
Okay, I'm very mindful of our time. It's 12:15. I do have another question here on the chats. Do you have any suggestions for losing weight when you don't even have enough energy to go through the daily basics?
Oh dear, yes. Well, there are I think if I had the answer to losing weight, I wouldn't be sitting here. I'd be earning heaps of money and, resting on a Caribbean island or something. There's no one really been able to easily have a kind of formula for losing weight. I think obviously there are three main reasons for weight gain. One is genetic inheritance. So we inherit the genes, and if we're unlucky, we may have the weight genes. Then there is obviously people who eat too much and people who don't exercise enough. And the eating too much, of course, is sometimes financially, they can't afford quality food, so stuff in anything, or people who are psychologically disturbed and use eating for comfort, and so on and so on. There are many, depression, many reasons, and medication for people who eat too much. And then there are the unfortunate people who would like to exercise but can't exercise for various health reasons, and that would cover the sort of ME people. So I think, losing weight with this illness is very, very hard, apart from almost starving oneself, which is miserable and depressing. So I think the answer is probably to get oneself under a clinic that specializes in weight disorders and get some help and advice appropriate to the individual, because we're all so very different, and what works for one will not necessarily work for the other. And some people have to come to terms with the fact they are going to be seriously overweight for their life because that's the genes they've inherited. So it's not a quick fix issue, as I'm sure we all know.
Yeah, definitely. Okay, I think we'll just wrap it up there. I know, I'm sorry, we've got people with their hands up and we've also got some more questions on chats here. Can I ask, what we might do, everyone, is if you can just send your question to your health and wellness facilitator, and then we'll get that to Dr. Vallings. And is that all right, Dr. Vallings, if you might be able to answer some of the questions?
Yes, that'd be fine.
Via email, and then we can disperse out those questions to everyone again. So because I'm just very mindful of our time, and I'm very mindful of everyone's energy envelope sitting here and listening. It's been a long morning today. So yeah, okay. So Dr. Vallings, thank you so much for your time today. If Dr. Ravi is still here, sorry, I've got so many screens because there's so many of you here. Thank you for attending. Yeah, thank you everybody for attending. Now, don't forget to look on your inbox for the link to Thursday's conference with regards to World ME Day, and we'll wrap it up here now. So thank you everyone for attending. Lovely. Bye.
Bye.